in terms of skills, what skills did you feel like you needed to sharpen a little bit for the home health pediatric area? Like, what skills really need to be in your repertoire to get into this type of specialty?
Yeah, really going over some of the neurological diseases that you come across. When in the outpatient orthopedics realm, you don't see nearly as much of them. You'll see, generally speaking, your orthopedic injuries, and then you'll get into some of your strokes that you will see as well. Usually in the acute care setting, you see them for a short period of time and then they move on, right? Your job is to send them home, right?
Hmm.
Yeah, that's a fun thing about acute care is that no matter what, nobody wants to be there. So they don't want to be in the hospital. They want to be out of there, right? So that's a common goal you have for every client in acute care is to get them going and get them back home. And then in home health, that's keeping them home. The goal is that they stay home. They don't want to go back to the hospital. They want to make sure that they stay home, they stay well, and they stay healthy. So in that aspect, I see a fairly large gamut of neurological injuries. So I definitely needed to kind of scroll back and look at that again and really dig into my own textbooks, Mike, because I hadn't seen that in practice a lot.
Interesting. You
Um,
had to go back to the books, huh?
yeah, yeah. Well, and it's helpful. It's helpful
Yeah.
because that way it reminds you, like, oh yeah, I do remember that, and I do see that, and what you take from each client is so unique, and because all their needs are completely different, even though they might have similar injuries or similar diagnoses, is that you are taking that kid where they're at. Like, well, and sometimes you're dealing with the mom and the dad as well of like, hey, what are your goals for your child? What do you want them to be able to do and work inside of that? So just knowing my patients and digging in and then taking my patients kind of their profile and their diagnosis and then creating that treatment plan, which is what we all do. All therapists do this for each client, but really digging in a little bit more. I've had to do some extra Google searches and things like that because there are some rare diseases out there that I haven't come across, but I have now. So it's just being open-minded. And really, the biggest thing you can do, Mike, is being adaptable. Because when you walk into somebody's house for the first time, it's just like being a traveler for the first day too. You walk in there, they don't know you. You want to work with them and you want to help them, but you're taking it all in.